Okay, so today what we're going to talk about is how to use self-myofascial release to help relieve back pain. Now, a lot of grapplers and combative athletes are going to suffer from low back pain. Now, to get a little bit more specific about this problem, it's not always a muscle issue. So what I mean by that is this past week or so, I've had a really tight low back. It's been really beginning to bother me. It seemed like, well, I'm just kind of chalking up to a lot of hard practices, a lot of hard failed shots maybe, getting sprawled on. Regardless if it's from good technique, poor technique, or just in general people stopping you and having hard rolls, I'm still having a lot of back pain. Now, I took 2 days off. I wake up this morning and it's still pretty relevant to the point where when I bend down, I almost kind of get more of a shock, not so much of that aching pain anymore. So what we're going to do today is kind of go over the reason why we're having some pain. All right, so as natural, everyone would assume that if you have low back pain, it's just a muscle ache, a muscle problem. And that's a very common situation, that's very normal. So for you to think of that, that's perfectly fine. You could put heat on it, induce a lot of blood flow, help recover it really fast. If this is a persisting problem like I'm having, it just doesn't seem to be going away. It's getting better, but it's not really going away. So what's going on is it's really not a muscle issue with me. This is something that bothered me about 2 or 3 years back, and I kind of caught on to it, studied a lot more anatomy, and figured out why my body was acting the way it was. So why did this happen? Numerous variations, numerous variables. I'm in a combative sport, it's jiu-jitsu, it's too hard to really pinpoint something. It's not like I'm gonna find out what went wrong and just not do jiu-jitsu anyway, okay? So what the problem is, it's actually my glute maximus. Now, you could say it's my IT band. Now, the IT band is a deep fascia that runs from the hip all the way down the thigh, down the side of the leg. Now, its main focus is to stabilize the knee and to stabilize the hip. A lot of times when you hear people have sciatica pain, they usually treat the piriformis because the pain would normally radiate down the leg, okay? My pain is radiating upwards. It's obviously not a muscle issue anymore. It's gone on way too long for multiple days. So what else could it be? So the IT band inserts itself into the glute maximus and the tensor fasciata, and that's where they all work together. Now the gluteal nerve runs in there. That is L5-S2. So what that means is I have an inflamed nerve, all right? Or the IT band, the glute maximus, everything else up inside of there, something is inflamed and pinching on that nerve. So I've been treating my lower back, but that's not the problem. All right, the root of the problem is really deep down into that high, guess you could say high part of the butt of the thigh, okay? Now, some people will find it that it is right there, deep in that glute max. Mine resonates a lot higher up, almost right there in the insertion point of the hip, okay? But that's that IT band. Remember, it's there to lock the hips in place and the knee in place. So, I'm going to take a lacrosse ball, and you can work and do this with me. How do you know if you need this regardless if you're in pain or not? If you stick this ball and you find a spot and it feels like someone came down like Satan and stabbed you with a soldering iron, then you obviously know you've got a problem and you need to work it out. Now, if you're an Eldola person, I'm sure they got different stretches, so please turn this off because I know you're going to get mad at me. All right, so I'm going to take the ball and I'm going to put it down here by my butt. Now, I'm not going to keep it on my butt, even though I may need that work. I'm now going to rotate until I find that groove between my muscle and almost my hip joint. How do I know if I find the right spot? Because it'll be abnormally more painful than just rolling on my butt, okay? So once I get it to that spot in. No. There. That's it. All right. Now I can't just hold it. Even though that works like ART, I'm going to move it a little bit. I'm going to find that spot that hurts the worst, even though a whole bunch of them, Bobby, do hurt the most. And when I find it, I'm now going to extend my leg out and then bring it back in. Extend it out and bring it back in. Now this can make the pain a lot worse, and it can also actually move the pain. And what I mean by that is that it almost like if it's knotted up, it'll move to another portion. So you may have to follow it with the ball and keep doing this, all right? And you may have to turn your hips in different spots and find that groove. Now, I'm keeping my legs sideways because that's where I feel it the most. And then sometimes I may actually have to turn, not turn my hips because I don't want to lose my spot. I want to stay where I'm at and then try to turn my foot up, toes up, and then back down or in, and then down, and then find that spot. How many times should you do this? Simply as many as you can to possibly reduce the inflammation. You'll know because it'll go from excruciating to a lot supple, all right? It'll be a lot easier to maintain. You can simply take a break and relax and redo it again. You can just do this while watching TV. You don't have to take time out of your day to completely devote a whole entire time to mobility work or fascia work. You can simply just do this while you're hanging out with your kids, watching TV with your wife, whatever it is. But it's going to work. Simply take your time. Now, here's another point that's extremely important when you are working in releasing muscle tissue, all right? You have to breathe. If you tense up, you're going to activate the wrong sympathetic nervous system. You're going to create a fight or flight syndrome, and your body will actually seize up automatically because of the adrenaline, okay? It's a natural reaction. You're going to have to decompress yourself, allow yourself to relax no matter how much pain you're in, and that will actually tell your body to relax and release itself a lot faster, okay? Yes, it's not a magical program, but at the same time, you may feel up to almost a 50% instant relief within the next 5 or 10 minutes after doing this, okay? Do this about every other day. You could do it every day, but be very careful because you don't want to re-inflame it and aggravate the shit out of it, okay? You're going to make it worse. So, self-myofascial release, if you're having low back pain, it is probably persistent coming from the L5-S2 gluteal nerve, which running down into your IT band, which is attaches into that hip section and that glute maximus area, all right? Work that out. Learn your more movement patterns, learn how to turn your glutes on, and strengthen up that ass, and you'll be good to go in the future.